The Kaiser Family Foundation presents Health08.org, election news, analysis, and events.
Congressman Ron Paul, thank you for joining us today at the Kaiser Family Foundation.
Thank you. Good to be here with you.
Thank you. What do you view as the most pressing health care problem in the United States?
Well, it's the fact that the system that we have today isn't working and nobody's happy. So changes have to come. And in the direction that we're going in, if we don't change it, the system will not be sustainable because we can't afford it.
And do you think the unhappiness comes from the cost, the lack of coverage, the quality of care? Which is it?
Yes.
All three?
All three. I mean, it just isn't working. The cost is going up, the delivery service is bad, the doctors are unhappy, the patients are unhappy, and there's some people involved for financial reasons. The care has been taken away from the doctor-patient relationship and delivered to corporations. So it's a Wall Street event. And people sort of recognize that, but they see the problems and they feel the problems. But unfortunately, too many of them saying, well, you know, we've tried government now for 35 years. What we really need is more government. And that's what we're involved in now, is making these decisions. And the country has to make a decision on whether we go toward a freer market approach or whether we go toward more socialized medicine, because we're in the middle now. We have corporate medicine, and I don't think it's a good system at all.
And as you know, there is this great philosophical divide that you just described between investing the power of healthcare in government versus the private sector. Some of your opponents among Republicans and certainly among the Democrats favor more government involvement. You fall on the other end. Why?
Well,
and how?
Because every service, I believe, you know, from a philosophic viewpoint, that all services and goods are best delivered in the marketplace under a free system. If you want cell phones, you don't ask FEMA to set up a bureaucracy and say, we want to deliver cell phones at the maximum effort, you know, most people, to give them to the most people possible at the cheapest rate. No, the market did that. Prices keep going down, whether it's computers or televisions or cell phones. Those prices go down in spite of inflation. We have constant inflation. In medicine, although there's more technology available to us, prices keep going up. So unless we recognize that, we will go in the wrong direction. And there's ways we can go in the directions of delivering health care in a free market system. It's through health savings accounts, letting patients have more control, make sure they can pick their doctors, make sure that if they want holistic medicine, they can. I'm also an advocate of a lot freer entry into the marketplace, because physicians and health professionals have always liked to protect their industry through licensures. So there are some things that a nurse could do every bit as well as I can do, but by the law, they can't do it and they can't prescribe. So you need more competition. So there's a lot of reasons why the free market could do a much better job at a lot less cost.
But in a Paul administration, what would happen to the government programs that we have now and have had for many decades? Medicare, Medicaid, S-CHIP, the program for children. What happens to them?
I have a precise answer for that, because obviously I don't run to be president or even run for Congress by saying, well, I'm out to cut off the medical benefits. But philosophically, I can make an argument that that is not the best way to do it. But you have to have priorities, even for myself, who's very philosophic and idealistic in the sense of moving one direction or the other. I certainly don't think that it's better to move toward the government approach. But I know this is about medicine, but I can't bring up medicine without talking about the amount of money we spend overseas. Because we are spending, our foreign policy involves up to nearly $1 trillion a year. And I think it gets us into trouble. I could cut $300 or $400 or $500 billion from that, still have a strong national defense, and have funds available to tide people over, people who have become dependent, whether it's medical dependency or Social Security. There's no reason why we should put them out in the street. But I would certainly encourage a younger generation who's very, very leery of this whole system because they know the entitlements can't be handled at the rate we're going. We're talking about $50 and $60 trillion in medical entitlements. I mean, it's horrendous. But I would say that you can do this. Let the young people get out. Encourage them to assume responsibility for themselves for their medical care, just like everything else.
Through their lives.
Right. And through tax changes and, various ways, but they'd have to assume responsibility for themselves. But now that they're recognizing the government's not going to come through, they probably won't come through any more than taking care of the victims of Katrina. At the same time, you would have more funds available to tide people over who become very dependent. Because once you get young people out of the system paying less taxes, you say, well, where's the money going to come from? Well, there's not a shortage of money. There's a shortage of wisdom on what the priorities should be. So I think very well, instead of now, they complain, we have to spend all this money on the military. We have to cut medical benefits, in some areas. We might make great promises, but they might start, nickel and diming. Even for some veterans benefits, they do that. But I think my approach is logical and could work, but it's major because you have to change an attitude about what our foreign policy ought to be.
But just to clarify, your idea is, it sounds like, is to maintain Medicare, maintain Medicaid. But for maybe those people who are uninsured, drive them toward HSAs. For the younger generation, have them begin thinking about health care as less an entitlement than some older Americans may think of it?
Yeah, I think that's pretty much my position, and it is maintaining, but with the idea that it doesn't have to be permanent or transition into more government control, because I want to get away from this corporate control of medicine. Mm-hmm. So yes, maintain in an orderly fashion, do it wisely, because the alternative is if we continue this way, we will have a financial crisis where the money won't buy anything. We might send the checks out for Social Security. We might, try to buy medical care, but it won't be available because inevitably, when you develop a system like this, where government gets involved, prices go up, services go down, and then doctors drop out, and then there are shortages. And that's what I want to avoid, the collapse of the system if we continue to finance it the way we're doing.
Do you have a philosophical belief that every American should have health insurance, have access to health coverage?
And I think you've stated it correctly, should, but I don't see it as a right, which is different for me, because you have a right to your life, and you have a right to your liberty, and you have a right to the property you earn. But you don't have a right to a house or a right to a job, and you don't have a right to medical care, because that involves a violation of somebody else's rights. And because they have to take it from them. You say, well, no, it's coming from the government. The government has nothing, produces nothing. So if I'm the government to give you health care, I have to literally take it from somebody else. And ultimately, it's a poor person because we usually inflate, we borrow, we can create economic conditions that hurt the poor. So even with this attempt to give this free medical care to people, it really undermines, and it's exactly what's happening today. The poor people who try to make it, they get gouged. I mean, if you happen to be working for a big company or working for the government, you get health benefits, dirt cheap. But if you're trying to make it on your own, you don't have insurance, and you walk in, you might be charged 2 or 3 times more than the government will pay for those services. So it has nothing. That's not the way a market.
You're talking about the working poor
who are uninsured. And that's why we have to emphasize, this idea that you can get major medical care if you can save a little bit of money and pay those first dollars and talk to the doctor. Before we had all this, medicine and the doctors always charged the least amount. Today, they have to charge the maximum amount of what they can get from the insurance or from the government. So the attitudes have been reversed of what happens in the marketplace. I remember when I was in the military in the 1960s, I'd been drafted and I was serving in San Antonio. So I wanted to moonlight a little bit, work in the nighttime, get more experience. I'd been out of medical school for 2 years. Mm-hmm. And I worked in the emergency room, and I made $3 an hour. but was experienced, and $3 meant something then. So, but nobody was ever turned away. Nobody were asked about their income. Nobody was asked about their insurance. But the church was taking care of them. The country was, in a sense, more prosperous and could afford it. And yet people did get medical care. So it isn't like everybody's going to be in the streets. Nobody can show us pictures of people being in the streets before the 1965, without medical care.